Officials issued a warning last week about a spike of COVID levels in the city's wastewater, and it's causing concern. Our Monica Robbins is over in Studio B this morning to learn more about how the city monitors wastewater. Monica?
Hey, Danita, thank you so much. Yeah, it's summer and we're getting a brief reprieve from allergy season. And the last thing you thought you'd hear is a sharp rise in COVID levels in Northeast Ohio. Do we have to be concerned about this? Well, to better break it down, we are going to talk about it with the director of the Cleveland Department of Public Health, Dr. David Margolius. Thank you for being with us.
Thank you for having me.
Okay, so you guys issued a report, and this was from the Ohio Department of Health, that there was a sharp increase in COVID, and that was from untreated wastewater samples collected from the Northeast Ohio Regional Sewer District's Easterly Treatment Plant. A lot of people had no idea that this was even being done. Can you explain what is being done and why?
Sure, yeah. So one of the two greatest innovations from the COVID pandemic was wastewater surveillance. The other was the vaccines that were created to save so many lives. But the wastewater surveillance is essentially, we've got scientists going down into your poop, Cleveland, and taking samples to look for viruses. And so we've been monitoring this for now almost 5 years. And this past week, we saw a sharp rise in the amount of the COVID virus.
We thought we were done with COVID. We thought that was, COVID cases were going down. So what are we seeing, and how is this happening, and why?
Well, the good news is that we haven't had any rise in hospitalizations, severe illness, or deaths from COVID. It's just that it's in the wastewater. And so there is so much immunity in our community thanks to the vaccines, thanks to people who have already had COVID, which is pretty much all of us. And so it's just important to be aware of what's going on. If you have symptoms like a runny nose, a sore throat, a cough, just recognize that you're contagious. You've got a virus, and so we'd really like you to stay home if you've got symptoms. And if you have to go out, back in the old days, it was kind of normal to wear a mask in the hospital if you had symptoms so that you didn't get other people sick. We want to get back to that. Just, when you're sick, wear a mask so that you're not getting other people sick.
Is it mainly, especially if you're around vulnerable people?
Yeah, the folks that we're most worried about are the elderly, so folks over 65. And so when we talk about vaccines, going forward, that's our main focus is people over 65, making sure they're staying up to date with vaccines, people with a compromised immune system, maybe from chemotherapy or an autoimmune disease. Those are the folks that we, most want to stay up to date with vaccines.
There is a new variant coming out, and we used to watch the variants like a hawk, but we're not doing that so much anymore. But the newest variant that's out there is doing something. It's called a razor sore throat. What does that mean? Yeah,
they're calling it Nimbus, and they're saying it has a symptom where it's just a sharp pain in your throat. Yeah, you don't have to pay attention to the different names of the variants. We will at the Department of Public Health. And so, looking backwards, every time there was a spike in cases throughout the country, initially we said, oh, maybe because it's Thanksgiving or July 4th or all these different things. But really, every time it was a variant. It was a mutation in the virus that just became more contagious and evaded our immune system. And so if there's a spike like is happening now, it's from a variant. And folks don't need to necessarily worry because the immunity from the vaccine and past infection is so effective. But, again, know that you're contagious and act accordingly.
I'm glad you brought up vaccine quickly. There's so much confusion. Who needs to get a vaccine, and do they need to get one now?
Yeah, so if you've had vaccines before, you've probably had at least 2 doses at some point during the COVID pandemic. A newer version came out in the past year. We recommend that everybody get that one, but in particular, folks who are over 65, folks who are immunocompromised, folks on chemotherapy, those are the folks who are most susceptible to severe illness and death. And so those are the people we want to be protected.
What's your messaging for people who keep hearing everything coming out from the administration? Because I'm not sure what to tell people because the messaging is really confusing.
Yeah, so you're going to hear things from the White House, and then you're going to hear things from the Center for Disease Control, which is down in Atlanta. I would stay focused on what's coming out of the Center for Disease Control. in Atlanta. They're giving the most up-to-date guidance. And, you know, if there's any big news, we'll be sure to help spread that news through the Cleveland Department of Public Health.
Dr. Margolius, thank you so much. Appreciate your time.
My pleasure. Thank you.
All right, back to you, Danita.
All right, really good information, Monica. Thank you so much.